What if you could solve a medical mystery, one that was pulled straight from a real residency exam? Well, today that's exactly what we're going to do. We're going to unravel a classic sexually transmitted infection called Chancroid. But to do that, we first have to spot the lie hidden among the facts. Let's get this investigation started.
All right, here it is, our challenge from 2006. The question is simple. Regarding Chancroid, all of the following statements are correct, except we've got 4 options. 3 of them are the real deal, and 1 is in there just to trip us up. Before I give away the answer, let's use the correct clues to build a profile of this disease.
You know, the best way to spot a lie is to know the truth inside and out. So first, we're going to piece together the facts about Chancroid from the correct statements in our question. Once we have a crystal clear picture, the false information is going to stick out like a sore thumb. First things first, let's identify our culprit. Clue B hits the nail on the head. The infection is caused by a bacterium called Haemophilus ducreyi. Now, it's known as a gram-negative bacterium, which really just refers to how it looks under a microscope after a specific staining process. Knowing this little organism is the cause is step 1 for any good diagnosis. This brings us to our second clue, and it's all about location, location, location. See, this infection is highly localized. Think of it like a local skirmish, not an all-out war. The bacteria gets in, causes trouble at one specific spot, and maybe in the nearby lymph nodes, but it doesn't go systemic, meaning it doesn't travel through the bloodstream to affect the whole body. This is an absolutely crucial feature of Chancroid.
And our final correct clue takes us right down to the microscopic level. A biopsy of a Chancroid ulcer reveals this really unique 3-layered structure. The top layer is necrotic, that's basically dead tissue and pus. The middle is where the body's fighting back, trying to build new blood vessels. And the deep layer is just packed with defense cells. This distinct pattern is almost like a fingerprint for the disease.
Okay, so our profile is complete. Chancroid is a localized infection, it's caused by H. ducreyi, and it has a unique 3-layer signature under the microscope. Now, with all that in mind, let's go back to our options and find the one that just doesn't belong.
And there it is, the imposter, option C. The claim that Chancroid usually starts with flu-like symptoms, fever and muscle aches, is completely false. But why is it false? Well, the reason gets right to the very heart of what this disease is all about.
This image says it all. Symptoms like fever and body aches are signs of a systemic fight, where the infection is circulating everywhere. Think about the flu, or even an initial herpes outbreak. But, as we've already established, Chancroid is a local battle. It stays put, so those widespread all over the body symptoms are extremely rare.
So, we've cracked the exam question, but how does this all translate into actual clinical practice? Let's take a look at the toolkit doctors use to diagnose and treat Chancroid out in the real world.
Beyond the clinical signs, one of the most memorable diagnostic clues is seen under the microscope. When you take a sample from the ulcer and perform a gram stain, the bacteria often line up in these parallel chains. Microbiologists famously describe this pattern as looking like a school of fish. It's such an elegant and really useful visual signature.
Of course, doctors can't just assume. They have to differentiate Chancroid from other conditions that cause similar sores, like syphilis or herpes. This chart is a great guide, but the biggest giveaway is pain. The ulcers from Chancroid are intensely painful, whereas the main sore from syphilis is classically painless. The mnemonic is simple. The soft chancre hurts, the hard chancre of syphilis doesn't. That detail alone is a huge clue.
And here's the really good news. The treatment is surprisingly simple and very effective. A single dose of the right antibiotic, whether it's a pill or a shot, is usually enough to completely cure the infection. It's a powerful, fast-acting solution for what is a very painful condition.
Now, it might be tempting to write this off as some old, historical disease, but its impact actually stretches right into the 21st century, and it plays a role in a much bigger public health crisis.
And this is why Chancroid is still a major concern today. Think of the ulcers it creates as a busted open door in the body's defenses. That open door makes it dramatically easier for other infections to get in, most significantly HIV. A person with Chancroid is 2 to 3 times more likely to either acquire or transmit HIV, linking this old disease directly to the modern AIDS epidemic.
Our ability to diagnose and cure Chancroid today stands on the shoulders of giants.
Robert Koch taught us how to definitively link a microbe to a disease. Paul Ehrlich pioneered the very idea of a magic bullet to treat STIs. And of course, Alexander Fleming's discovery gave us the tools to actually cure them. Our simple single-dose treatment is the direct legacy of these Nobel Prize-winning breakthroughs.
So, we're left with this thought. A disease first described in the 19th century is still teaching us vital lessons about 21st century epidemics. It's a powerful reminder of how infections interact and how one breach in the body's defenses can fuel a much larger crisis like HIV. It just goes to show that in medicine, the past is never really in the past. Thanks for diving into this with me.